Friends, welcome back to the show. I wanted to take a few moments and speak no script, and we'll see where it goes. I just wanted to give a sincere thank you to each and every one of you that listens to the show. I know you could be using that time to do anything else, and I'm very conscious and protective of that time. And I'm always looking for ways to add more value through things like production, as well as through myself as a podcast host. And I'm at the point where I feel like I'm just getting started. I promise to continue to work each and every week to add more value and get you guys more return on that time. And my only ask is that you take a moment to go ahead and hit the follow or subscribe button that's right here on this app. It helps tremendously in allowing more people to find the show. And in turn, that allows me to get the guests that you guys want me to speak to. Thank you so much. Thank you for listening to the Chase Merrill podcast. So like I'm watching just like a bunch of YouTube videos whenever I'm stretching or doing anything like that, just to kill time. Yeah. And I was watching one today of a CrossFit Games athlete. She's injured right now. I don't think she's been gone for the couple years. Ellie Turner, she just did a triathlon. So I was kind of watching her story, but she just has like constant back problems, like always, like she's always in pain. Luckily, I've never had an issue with back. Like I've definitely had my shoulders and my knee, but for me, my back is never so much as a twinge, which is great. But I see how like debilitating back injuries are for everything. Why are they so just debilitating in that aspect? Why are they so just, you can't do anything?
Yeah, I think it's almost ubiquitous, right? It's like, you look at the numbers and it's like, 80% of people in the general population will experience some sort of back pain in their life, right? Um, it's just one of those things where it's so hard to put your finger on like, the actual problem, right? Because it can be so many different sources of pain. It can be coming from like, is there an issue in the spine itself? Is it a muscular issue, which most times it is, right? Most times it's not that serious. Um, and then like just the pain itself is a very complex issue. Um, there's so many things that go into it. Like I said, like, is it an actual injury? Is it, and then once you injure it, right? Some people are afraid to, you know, they get really scared. Like I had my wife's friend just hurt her back the other day, and she's like, "I'm really scared. Like I don't know what to do. Like, do I move? Do I go to PT? Do I get an X-ray or an MRI?" Um, People just get really scared, I think, when they hurt their back, and then what happens is they develop a fear, I think, of movement, and then they're afraid to do it again, and then it just kind of cycles and creates this vicious cycle, and then it's something that is really hard to fix and get to the root of,
Yeah, absolutely.
Yeah.
What is your experience with dealing with these kind of issues? I know like why most people wouldn't say like spine or injury prevention or anything
Yeah.
like that. What is your background in that?
So as a PA,
Mhm.
I practice so it's interventional pain and spine, so pain management.
Mhm.
Um, we see all kinds of pain, mostly back and lumbar spine, is most common. Obviously, you get some neck pain in there. A lot of them are from like post-surgical things. So somebody messes up their back, they go see a surgeon. The surgeon says, "Oh, I can fix this," right?
Yeah.
And they do their work, and they didn't fix anything. So then they come back, and they're still in pain, and they're like, "Well, what can you do for me?" Um, and so my job is when I see these people, I see them on a monthly basis, and I'm constantly preaching movement as medicine, basically, right? Because if you look at like the treatment algorithm and how to treat patients with back pain, first line treatment is always physical therapy, right?
Mhm.
And I think people, they come to you and they kind of want you to fix the problem, and then I'm always spinning back. A lot of this falls on you, and what can you do for yourself? We're just here to kind of help you get you through the process, really. Um, so I've been doing that now for about 5 years, and it can become, it's a good thing. It's a rewarding thing, practicing medicine. but at the same time, it's very frustrating. So,
Yeah, I
you
mean,
know,
for sure. I
yeah,
see that kind of secondhand from what my wife, obviously, she's going through medical school right now, as we were saying earlier.
okay,
And she kind of off and on, it's kind of like, oh, I really want to do this. I really want to help people. But then it's like, but
yeah,
then this gets kind of presented in this way and it's not the best way. And I already, and she's very active. She runs marathons and she
yeah,
knows like, movement. And she knows that a lot of the time, unfortunately, when people come to the doctor, they don't take that ownership at all. They're like, hey, just give me the pill, give me the whatever it is, instead of like taking the long route. So I'm
yeah.
sure that's something you deal with all the time.
Oh, for sure, and that's why, like, I got into medicine. I'm sure we're the exact same. Like, I think you almost romanticize it, right? And you're like,
Mm-hmm.
oh, like I have this background in sport, and like I think I can help all these people, with exercise and like change their life, right? And
Mm-hmm.
then you get into it and you realize that a lot of the people that do come in and do want your help, like they want you to fix the problem,
Yeah.
and they want the pill and they want the overnight change. And that's what's
Mm-hmm.
really difficult about medicine is that you know Western medicine is great and it's fantastic, and you know we live to 80, 100 years old because of medicine. But at the
Mm-hmm.
same time, like I think the system that we have is a little broken, and that we just treat the symptoms and don't ever really get the time to help with the root cause. And
In
that's
your
that's tough.
in your opinion, why is it that all of these, when like you were saying, when people go to doctors or surgeons or anything, they're like, let's go straight to surgery, let's go straight to the spinal fusion or whatever that is. Do Is there a time and place for that in your opinion, or is that like why is that
Sure.
always so common?
Yeah. So in my experience, I think there's severity of injuries, right? And
Mhm.
if somebody comes in with, there's red flag symptoms, right? There's, the saddle anesthesia where you can't feel anything, you know, in the saddle area. There's, leg weakness,
Mhm.
losing function of your bowels and bladder and stuff like that. And those are medical emergencies. So like surgery, 100% indicated for that. But I think that's a very small percentage of injuries and things that happen. The vast majority of people come in and they just have back pain. Sometimes it is pinching a nerve. Sometimes they do get pain down the leg. Um, and those are the things that can be fixed with time. It's just that it's not fast enough, right?
Mhm.
And that's
Mhm.
when it's been a couple weeks or maybe a couple months and you're still having pain, and that's when somebody's like, "Oh, well, like this guy fixed my back. You should go talk to him." And then they go see the surgeon, and maybe they do have a disc herniation, and the surgeon's tool to fix things is a scalpel, right?
Mhm.
And like they're like, "Oh, I'm looking at your imaging and it correlates to what you're feeling. I can fix this for you." And they have surgery, they have a fusion, and like I said, they're right back talking to me about how they still have pain because they didn't ever fix, I think, the movement pattern or the movement dysfunction, right? Because a lot of times that's what happens. Like you bend over, you pick up a toy, and you throw out your back.
Mhm.
Um, yeah,
When these people go, let's say it is for, the lower back, like they bend over, they have pain,
yeah,
they're uncomfortable when they sit and they go in, the surgeon's like, hey, we're gonna cut, we're gonna do what we need to do here, and then
yeah.
they still have the pain and they come to you. Do you have like a, hey, this is gonna fix it, like we need to strengthen your glutes, or is it like case by case? Like, is there usually a common factor?
Yeah, so when, like, they come to me, like, after a failed back surgery,
Yeah, in this
um,
instance, or
yeah, they like I said, we have things that we can do as far
Mhm.
like, less invasive things, which are
Mhm.
usually injections. So we have, like, nerve blocks at our disposal or an epidural, and what that is a tool to kind of calm down any kind of pain, and it gives you a window of time, right?
Yeah.
Just like if you were to take, like, a pain pill. It gives you a window of time, right? And it gives you like a few hours, the pill does. The injections maybe give you weeks or months of time to where the pain is less. And then that's when you really should use that time in conjunction with therapy, in conjunction with strengthening the core and the glutes and the hips all together. And then the strengthening is really what takes the place of those other interventions with like the medicine and the injections.
Mhm.
That takes over, and then the idea, the theory is that the therapy, you know, helps the most, and then you don't have to use those other interventions. You don't have to use the medicine anymore. You don't have to use the injections. But the tough part is time, right?
Mhm.
Because, like I said, we all romanticize medicine, but then when we get there and you can only spend 10 minutes at a time with a patient,
Yeah.
it's really hard to kind of relay all the information that they need.
I know, like, you're seeing these are are you still active, like, as a PA? I know, or do
Yeah.
you do, like,
No,
all
I still
okay,
practice 5 days a week.
okay, okay.
Yeah.
So you still go in, you see your patients when you see
Yeah.
them. For your online, I saw you do coaching and programming as well. Is any of that do people come to you kind of remote and say, like, "Hey, I have these issues," or is it usually for, like, "Hey, I wanna get fit," and stuff like that?
Yeah, I think it's a good mix.
Okay.
I think people do come to me because I do have that background.
Mhm,
Um, but it's definitely a good mix of, hey, like I just want to get in shape and like lose weight and just build muscle in general, which is great. And I think that's kind of mixed in with like, oh, I do have this back pain too, which, like I said, is so ubiquitous. Like I think,
mhm,
like you being the outlier, like everybody's like,
mhm,
oh, I've had back pain before. Like I've thrown my back out, and like, oh, 6 months ago it was hurting, so like we can work on that too. Um, so that's a big focus of my coaching. And honestly, like that's why I started doing it. That's why I started doing all the social media stuff because I was really handcuffed with what I could do in the practice.
mhm.
Yeah.
When these people do come in, or even online, when you start coaching them, do you have that conversation about time? Like, "Hey, like, we gotta be, like, at least 6 months or what, or at least a year," or what is that conversation looking like?
Oh, for sure. Yeah. I mean, if again, if they're coming to me for just general wellness, like yeah, the conversation is always, if somebody's like, oh, I just want to do like 3 months, just kind of see how
Mhm,
we go. I'm like, okay, but like, if we're doing this the right way, it's gonna take time, and it
mhm,
could take you might not see a whole lot at 3 months. So yeah, 6 months. The longer you stick with something and you're consistent, the better results you're gonna have. And and yeah, the same goes for anybody with back issues. Um, and I tell my patients too that they've been coming to me for years, and the solution they're looking for, it took it took years to get to this point of like deconditioning and not taking care of themselves. And
mhm,
like you got to expect like it may not take the inverse of that. It may not take a decade to get better, but you got to give yourself some time and be like, it might take, it might take 6 months. It might take 12 months to kind of like maybe see some light and be like, oh, like this is working.
mhm. Yeah,
Mhm.
that's a really good point. If people
Yeah.
don't think about that, and it is the unfortunate thing both in medicine and in just fitness in general. It's like, you got to this way for decades of not moving and not
Hey.
eating a healthy
Yeah.
food. You can't expect it to be that switch that changes in a week or anything
Yeah.
like that.
And that's what's so discouraging for people too, because like, yeah, like you said, like they've been at this for 20 years. They're, and that's like, you know, that's not a long time for a lot of these people. A lot of these people is like 30, 40 years deep, and they come in, and now a lot of the things that I say, it's like it just goes in one ear out the other. They like because they can't conceptualize, they can't imagine making these shifts because
Mhm.
it's so ingrained in them. And that's the tough part. It's like,
Yeah.
you can just make these little changes, and then like you get in these conversations, and then you're in the room for 25 minutes, and then you got to get out, and that's what's so frustrating about medicine. It's like you want to help and you want to give the time, but like I said, you're handcuffed by insurance companies because they're the ones
Oh yeah.
paying your salary.
Yeah. Wi- it's Something that I was thinking about the other day is like when you have people who come in from these positions of pain or not in shape and they want to, I want to get to a certain goal, whatever that is for them.
Yeah.
Unfortunately, they're so focused on just getting to that goal, like I want to look this way, that if you can get them to focus on like I want to change like my habits and my life, and you can like really start to get them to enjoy the journey, it takes a lot of that effort and that emphasis off of like achieving that because you're just enjoying the benefits that you're seeing in your life and changing your habits there. And so if you can get them to do that, it's huge.
No, for sure. Yeah. Um, yeah, big time. It's just, it's tough. Some of the things that I like, that I'll put out as content, I'm sure you can attest to this. Like, we've been doing this for so long. We've been like, active in things. It's like a lot of the basic things seem like it may not be useful for people, but
Mhm.
the very bit, like, you'd be surprised that so many people are at such a basic, like, their baseline is nowhere near anybody that's fit. Um, so it's really important to, like, to put that stuff out there too, and that these people, like, there's so many people that need just basic stuff to start, and that's really important too.
Yeah, that it's something that I've definitely been guilty of. When I first started, so I started competing in CrossFit and doing like Olympic weightlifting. And
Yeah,
then just like I would get my CrossFit level one and I just kind of hop in and I coach a class every now and then. And I was just
like,
like so used to, being doing fitness for such a long time and doing those things that like when you hop in, you forget. Like some of these people are like, you forget, like, okay, we're going to do an air squat, everybody. And everyone's like, what's that? How do I do that? And it's like,
yeah,
you have to like break that down and teach them, how to track their knees over the toes and how to, engage their butt and set it back and drive their knees out. And that's a very good point is like when you do it for so long, you've done it for so long that you just forget kind of everything else. And you need to be able to really break everything down, even the most simple stuff for for people to really get on board. And the
uh-huh,
unfortunate thing too is people in the when they do start on this journey is they don't want to look dumb a lot of the time. And so they
right,
won't ask and they'll just keep on going.
yeah,
It's, and so it's on you as a coach to really kind of create that environment and make them feel welcome to
for
ask those
sure, yeah,
questions.
and the same goes for like nutrition too.
Yeah.
Um, I mean, you'd be amazed at like the things that I hear on a daily basis about just basic nutrition. It's something like, for example, I think somebody was drinking like a thing of orange juice, right? And like type 2 diabetic, like, so the sugars are out of control, like
Mhm.
very uncontrolled diabetes, and they're drinking a big thing of orange juice. And I commented on it. I was like, hey, like, do you know that's full of sugar? Um, and the response was, well, if I drink some of it, I'll drink some of it, and then I'll just fill the rest up with water, so I'll dilute it so it's not as sweet. And I think that's a great idea in theory, but you're still
Yeah.
drinking all that sugar. So, like,
It's
like basic things like that, um, which you would think are common knowledge or not.
yeah.
And then so it's really important that, yeah, we kinda get back to the basics with nutrition too, because a lot of people don't, need need the nutrition.
When I mean, so speaking of nutrition, is there a certain way that you lean? Like there's so much, unfortunately, there's not a lot of like, hey, diversity is king right now. It's either you're in the carnivore camp or you're in the vegan camp, or maybe
Yeah,
you're animal based or whatever.
uh-huh.
Where do you kind of fall?
I fall in, like, the, I guess, moderation and, like,
Yeah.
how much are you eating, right?
Yeah.
And, like, you can technically eat whatever you want, but how many calories are you eating? Because I think that's what it ultimately boils down to as far as weight loss. And you can, if you still have control, you can have a donut,
Mhm.
but as long as you're keeping the other things in check, I think that's most important. Um, and still being able to enjoy food.
Mhm.
You don't want to restrict so much that you you're just going crazy, and then you binge
Yeah.
and just ruin all your progress. So I think it's
Do you,
you got to go well rounded.
yeah. I saw your post the other day about you were having like rice cakes with peanut butter and then like other peanut
Yeah,
butters like seed oils won't kill you. Talk to me about that because that's a hot topic right now.
it is a hot topic. Yeah, and you know what's funny is because like I think like a couple years ago, my wife and I like we bought into all that. Like
Hmm.
we were like, all right, like we can't. All right, no more seed oils. Like we can't use that because it's the hydrogenated vegetable, like which isn't great. But um, I like I said, we just bought into it and we tried to stay away from it. And with like coffee creamer, like I'll still use coffee creamer because like I love coffee, right?
Hmm.
And but like so we tried to buy other things, and now like I think the more you look into the research, it's not gonna kill you. And I think like everything else, if you have a well-rounded diet, I think there's definitely a place that you can use seed oils.
Hmm.
And so I've kind of done a 180 on that myself, and it's not going to kill you. And if you just eat mostly whole foods, I think you're going to be in a good spot. You know?
For sure.
Yeah.
There was like a year and a half ago, I went like strict carnivore for a few months, and it was great in terms of like it's a top tier elimination diet, and so you can like introduce things back in. And so I went like hardcore carnivore for a couple months, just eliminated everything to see how I was feeling. Felt good. Started introducing more quote unquote Paul Saladino animal based foods, whatever,
Yeah.
whatever. So fruit, honey, dairy products felt great. Training for this triathlon, like introduce, breads and like sourdoughs and oats and vegetables. Again, I feel great. And so it's kind
Yeah.
of, it's so frustrating and it's so interesting to see people who just push one thing when it's like diversity and whole foods is phenomenal for you and for your gut and for life.
Yeah. That's the like you zoom out, and varieties and moderation and balance has always been good for everything in life.
Mhm.
And you can say the same thing about, about exercise too. You're training for a triathlon, so you're going to be good at swimming and good at running, and your aerobic fitness is going to be good. Then you also lift weights, and it's like, yeah, the extremes always get all the attention, and it's not where it's at.
A general rule of thumb for me is like if it's boring, it's probably right.
Exactly. Yeah, and also the other is like the truth, or like yeah, the truth is ultimately like somewhere in the middle of
Mhm.
of all of these of all these ideas. And yeah, I just the seed oil thing, and like that's what
Well,
gets all the views there.
yeah. I mean, what's super interesting is like you have people in those camps like Dr. Anthony Chafee and who's been on the podcast. I've talked to him. He's a carnivore
Okay.
guy. Paul
Yeah.
Saladino. Like you have these people who are, doctors, they're MDs and they cite papers, they cite things that like back up their side. And then you have people on the vegan side who
Yeah.
cite their papers and cite their sources who are also, MDs. And so it's just like you throw your hands up in the air. It's like, well, if everybody's citing the research, where I don't know what to go with.
Yeah. And then that circles back to like when it gets to like the regular person, they don't know what to believe. The hell,
Hmm.
like, what do I believe? Do I believe our seed oil is bad? Are they good? Are our eggs bad? Are they good? Like, it's so confusing, and
Yeah.
it's you can't blame people for not wanting
Yeah.
to jump into it, and have that
I
reservation.
remember watching I can't remember what documentary it was. It was like a pro vegan documentary on Netflix or something. It was
Mhm.
like 6 or 7 years ago. And they talked about how like eating one egg was like the equivalent of smoking 4 cigarettes. Like that was like a big
Yeah,
thing that they push. And it's like mind
yeah,
boggling.
yeah.
The light fell on good.
I figured that was gonna happen. Um, no, I think I remember that documentary. Damn, sorry.
No, you're good. Having some technical difficulties. For listeners. I started listening to podcasts back in early 2016. And since then, I've listened to a lot of episodes and I've covered a lot of ground. And I always get asked, hey, what's your favorite show? What's your favorite episode? So I made a list. I made a list of the 10 most impactful episodes I've listened to over the 9+ years, and it's completely for free. You can find that in the description of this episode or on my Instagram in my bio. And I hope you find those episodes as enjoyable and impactful as I did, because they are in part a huge reason why you guys are listening to me right now. Thank you very much. Now back to the show. That was the biggest surprise when I came out to Denver from Salt Lake, because it's the same time zone, but it's 7 hours east and it's the same exact time zone. So like when we moved here,
Yeah.
we we moved in the first day, and then like we woke up the next day and it was like bright and sunny, and I like did my started waking up and I was like, okay, cool, like it's got to be like 8 o'clock right now, and it's like 5:30 a.m. So yeah, the time schedule out in Denver is crazy, at least to me, coming from Salt Lake.
Yeah. Oh, you were in Salt Lake before?
Yeah, yep.
Yeah.
I'm from Southern Illinois. Was about 5 years in Salt Lake where I met my wife, and then we came over here to Denver, which has been
Nice.
good.
That's awesome.
Yeah, but just to circle back what we were talking about eggs and cigarettes, is like it's mind-boggling that somebody can actually post that or like make that into like a major, like it was a very popular documentary,
Yeah.
and feel comfortable saying like, hey, if you eat this egg, it's like the equivalent of smoking 4 cigarettes.
Yeah, it's wild. I don't know, like, how you can get away with that. I guess you can twist the data however you want.
Mm,
Um, but yeah, like I said, and then that creates the hesitancy for normal people who watch something like that, and they just get so confused, and then they get, you know, paralysis by analysis, and
mhm.
they just keep doing whatever they've been doing, you know?
Exactly.
Yeah.
Uh, I mean, I wanted to circle back. I don't know if you remember this, and I think it was Robert Oberst. He was a professional strongman.
Uh-huh.
I don't think he competes anymore, but he was on the Joe Rogan podcast many, many years back, I think 4 or 5. And he
Yeah.
talked about how if you're not a professional power lifter or strongman, you shouldn't be deadlifting. And I remember listening to that and I was like, well, I disagree with that. Like, I think deadlifting probably has a lot of value. What is your opinion there?
I think I'm definitely in the camp that it has a lot of value. Um,
Yeah.
but I think it varies by individual. Like when I was younger, I think I was definitely one of the guys in the gym that I was just trying to lift as much as I could. And
Mm,
I think I posted about this not too long ago that I hurt my back, and I remember being at a chiropractor and he was like, "So what brings you in here?" And I remember I was like, "God, I was 400 pounds on the bar and I was trying to deadlift." So I've always had like a recurring back problem,
mm,
and maybe that's kind of what led me to
yeah.
what I'm now. But I think for me, like mechanically, I think a traditional barbell deadlift isn't that great, and that can be true for a lot of people. But I still think there's ways around it, and that you can find different ways or different variations of the deadlift where you can still load that hinge pattern and still get the
Hmm.
same benefits. So I think,
So more like a hex bar where it's like more of a
yeah,
neutral
I
grip.
mean hex bars are great, or you can do sorry man, I'm gonna try to fix that again. Um, sorry.
You're good.
All right, is that okay?
Yeah, you're good.
Okay. I think that yeah, hex bar is great. I do a lot of kettlebell stuff, so I think you can load single leg great, and the kettlebells kind of give you the hex bar kind of feel because everything's to the side,
Mm.
and you're not loading as much on your spine as well. So I think using those alternative forms is a great way to get around the traditional barbell or the risk per se of the barbell deadlift.
What is your opinion on things like a Jefferson curl? Like where you're going and like
Yeah, no, I think they're great. I think, like with caution though, right? Because like every movement, I think you kind of have to progressively overload. So I wouldn't tell
Hmm.
somebody who's never done a Jefferson curl to, to grab even 50 pounds and do one. Um, so like obviously you would want to start with body weight and then progressively overload it. But I think getting strong in that flex spine position is critical. And that's something that I think the vast majority of people could 100% benefit from. And that's one
So
thing
you,
that I try to like explain, and that's one of the things that's really hard to explain to patients because
mhm.
most of them will come in and they'll be like, "Oh, I hurt my back bending over picking up a rug." Like I was with a patient today who said they did the exact same thing, and my mind goes to, you need to strengthen in those vulnerable positions with that flex spine. But how do you explain a Jefferson curl to somebody in 10 minutes?
Yeah,
Yeah, so I
that's
think they're
tough.
super beneficial. Yeah.
How heavy do you like if you're somebody and you've progressively overloaded it? Is there like a hey, you're not going to see very many benefits past doing this, at 95 pounds, 135, or should they keep going to a certain degree?
Um, at this thing, I think the average person, the general population, you're not gonna have to go that heavy.
Hmm.
Because when you think about it, like the general person, they just want to be fit and they just want to be able to live their life, and they kind of want to just be able to live better outside of the gym, and like that's the goal. So I
Hmm.
think if you're doing a Jefferson curl and you start with your body weight, and then you get to like 10 pounds, 20 pounds, you know, 50 pounds, you're not going to be really lifting much more than that in real life.
Hmm.
Maybe maybe a child but I think there is diminishing returns as far as like getting stronger in that area. It'll probably increase as you get to like you know I guess the weight is kind of arbitrary, the number, but um so I think where you get to being comfortable with the weight.
Okay.
So but I wouldn't put like an end goal on it per se.
What would you say to somebody who didn't have like an acute event that caused the back trauma? Like if they're just somebody who works like a 9 to 5, they're sitting a lot, they're not active, they're having lower back pain. If there was like, if you could say, hey, the top three things that you'd say to them to be like, hey, you need to start doing these, and it'll probably help your back. Assume with just a general.
Yeah. So I think the vast majority of people from sitting, they're in a flex position all day. So I
Hmm.
think you have to do kind of the reverse of that. So one thing would be like a back extension is definitely a great thing to kind of to strengthen those paraspinal muscles and to counteract the the active sitting all day. The other thing I would say would be hip mobility because like I said, like hip flexors are often very tight in that flex position. So working on hip flexor strength I think is really important. And then obviously the opposing muscle of the hip flexor would be the glute. So things like, glute bridges, anything to strengthen the glute as well, because I think the second most common complaint other than back pain is somebody says I have hip pain, but they're pointing
Hmm.
to the outside of the hip, right? And that's usually where the glutes attach, some kind of tendinopathy, which usually points to a weakness in the glutes. which is
Hmm.
which is super common. So those three. So hip flexors, glutes, low back.
When you say that to people, are people ever like, no, it's my back that hurts, not my hips, not my glutes?
Oh, all the time. Uh, but I think as like when you're trained in when you go to med school or PA school or whatever it may be, the way you're trained is when you hurt a joint, say you hurt your knee, you always examine the joint above and below the
Hmm.
injury. Well, so if you hurt your knee, I'm gonna check your hip and your ankle as well, just to make sure there's no injuries there. So the same goes for the back. Like I always try to explain, I know the back may be hurting, but there might be adjacent segments or adjacent body parts that may be contributing to the back pain that and then your back pain is the back maybe where the problem is, but then maybe that's compensating for your mid back or your hips, and then that's what gotta help strengthen as well.
Are you familiar with Kelly Starrett? He's kind of a mobility guy. He wrote the book Becoming a Supple Leopard. I think it's
Mm, I haven't heard of. I think I've heard the book.
yeah.
Yeah.
He talks about all the time. He's like, very rarely is it the place that hurts on your body that's the problem. It's like he always talks about how you need to look up or down
Yep.
for something.
Exactly. And that's the thing. Like, so people will get like a radiculopathy that goes down the leg, and maybe that is from the back. Um, and they're thinking it's a leg problem, but it's actually a back problem. So
Mhm.
yeah, I mean, yeah, most times, more times than not, there's you can't pinpoint. It's more than one thing.
Absolutely. I was like, and I obviously for I'm doing this triathlon September 7th, and then I signed up for a 50-mile ultra marathon October 17th.
Oh man,
And so the longest I've ever ran will be on September 7th when I complete the 13.1 miles at the end of the half Ironman. And then
that's
I'm gonna jump up less than a month later to a 50 miles. And so I've been front loading. I've been running a lot more on this
yeah,
triathlon to kind of prep for that little bit, so I can not be completely annihilated. But
yeah,
my left knee on the outside of my knee just started like this past week feeling like my LCL was feeling a little unstable. I was feeling
yeah,
like, and so I just sat down. I was like, hey, I'm running a lot. I really need to probably loosen up, my calves. And I need to loosen up my hamstrings. And so I just spent a lot of time yesterday rolling that out, stretching that out. I got
yeah,
some like floss, like the voodoo floss, and like floss my knees and my ankles.
yeah.
And then today I did a long tempo run and no pain. And it's like I didn't really do anything with my knee. I just addressed everything top and below, and way better.
Exactly. Yeah, same goes for me. So like, I picked up my running as well. Like, I'm not racing anything, but just volume. And about 8 months ago, like I dramatically increased. I ran 10 miles instead of 5 one day, right? And
Mhm,
uh, plantar fasciitis. I don't know if you've ever had it, but it's not fun. And
mhm.
it stuck around for like 6 to 8 months, and it took forever to go away. But yeah, I was focusing on my calf strength and my ankle mobility and all the structures surrounding the plantar fascia because, like you said, it's not always exactly where it hurts. You gotta strengthen above and below. But you're doing an ultra. I feel like the ultras are the new the new thing.
Right.
Yeah,
Yeah, my sister wanted to sign up. So this Ironman I'm doing with my four younger siblings, so all five of us are doing it. And
yeah,
then my younger sister wanted to do it. So I was like, "Okay, I'll do it with you." No real goals or ambitions, just gonna
yeah.
kind of go in and try not to die. It's through like this super isolated desert mountain region in southern Utah. So
Oh,
it's
really?
yeah, so it should be pretty fun in October. So I got to do some more research on that.
You didn't want
So,
to do Leadville?
right, that just happened. They just did the. I had a couple friends who did it. I would love to do it maybe at some point, but I'm not that ambitious to go straight to. I think it's like close to like 30,000 feet of elevation gain across it.
Yeah, yeah. It's
Yeah.
pretty. It's wild. Yeah, I follow a couple of those guys, and they're I don't know how they do it.
Yeah, they're machines.
Yeah.
Yeah, I have no desire to do that quite yet. Maybe I'm sure that's where it'll go eventually, but we'll
Yeah,
see.
eventually, you keep challenging yourself and, what's the next thing to do, right?
Yeah, exactly. You've got to keep moving. So let's just say in my position as somebody who is got a little bit of volume, I've been logging probably 30 to 40-mile weeks
Yeah.
prepping for this. What would you say? Like, hey Chase, like I don't want you to get hurt. You need to start doing X. Any tips for me?
I think, well, with the running, I think what a lot of people, well, like strict runners,
Mhm,
I think they neglect their strength work.
mhm,
Um, you always hear, or at least I always see that, like, when you're running, you're absorbing like 8 times the amount of force in your cat, like with every stride. So
Hmm.
it's a lot of force. It's a lot of load on those calves and just your legs in general. So strength training, I think, is crucial. Um, Everything in life, but more importantly, running. So a lot of strength, a lot of single leg strength, um, a lot of plyos, a lot of plyometrics, and doing those at least, say, like at least 2 to 3 times a week. Um, as far as like injury prevention. Um, but yeah, so I think that's really important. And I think that's a lot that people miss
Yeah.
when they're
What is your opinion on like Ben Patrick, knees over toes guy, like walking backwards,
no.
that kind of thing?
I I think, I mean, he's onto something. I think
Yeah.
so. I think he's even said it himself that, like, the whole knees over toes, like, yeah, it's his thing, and like that's what he's known for. But I think he said it himself that, like, he doesn't do it a whole lot, even though like that's like the only thing that gets pushed out from him,
Mhm.
and like all the guys that do his coaching or whatever. Um, so I think it's good because I think you need that full range of motion, and living in that deeper range is a really good thing that people avoid, because I think a lot of times most people don't, and I think a lot of the pain or discomfort people have is just like a sensitivity to the lack of movement and the lack of range that people have. So it's like, oh, when they hit a different range, or they're always sitting like this, and if they hit this range, like, oh, that kind of hurts. It's just like
Mhm.
you're, and it's a pain sensitivity, and you you give it more. What am I trying to say? You expose it more to that range, and you become more comfortable in it. And so I think it's a great thing that what he's doing. I just think that gets all the attention. I think he's
Yeah.
doing all the other stuff right as well. Um, but like we said earlier, like the extremes of things always get all the attention, and it's just like, oh, just do knees over toes and pull a sled, and you'll be good. And it's like, yeah, you need a
Yeah,
little bit more than that.
for sure. One of
Yeah,
my favorite like prehab, whatever strengthening movements that I like to do is I love doing TKEs, like the terminal knee extensions,
yeah.
where for me, those are phenomenal and like bulletproofing my knees and helping them, making sure they stay healthy.
Yeah, and a lot of actually my knees just started. I think like you call it like the runner's knee or whatever in the
Mhm.
front. But a lot of isometrics, which I think
Mm.
people neglect and are super underrated, because it's like, you don't, like, they're hard, but I think inherently people don't really think it's doing much because you're not moving.
Mhm.
You're just struggling. But I think isometrics are really good for tendon strength and protecting and injury prevention, especially as we get older, because you don't want to be the old guy that tears an Achilles when
Oh yeah, geez.
you gotta take
And
off.
that one takes forever to heal. There's so little
Yeah,
blood flow going on. No, thank you. That's like a nightmare injury for me. Like all time, like top three, like worst injuries I can think of is like tearing my Achilles.
big time.
Brutal.
Because
There was,
yeah, I feel like it's so common too. Like, you a 40-year-old man like tearing Achilles playing basketball. It's terrifying.
yeah, it's horrifying. I was doing a lot of isometric work back when I was competing in CrossFit and doing that
Yeah.
thing. And whenever anyone said like, "Hey, isometrics are tough," I'd be like, "Okay, come do this finisher for me with me." And it's like you have to hold like you get into a lunge position like 90-90, and then you just come like a half inch off the ground with that knee, and you have to like hold it for 90 seconds, and you're just like shaking. It's just
It's so hard.
it's so tough.
Yeah.
What when it comes to your coaching and your online programming, is there any specific clientele that you cater to? Do you take on everybody, anybody?
No, I mean, I don't have like certain criteria you have to meet
Mm.
to coach. So, um, it's mostly guys, probably, 30s, 40s that are out of shape, have back pain, the typical stuff.
Hmm.
Also have a lot of females that I coach, with the same kind of issues. But no, I mean, like, it's the thing. It's usually like I'm, you know, used to be an athlete, or like I've just neglected things over time, and then like the dad bod creeps in, and it's like,
Okay.
you just want to get back into shape to just to be capable. I think that's what it goes back to. It's like, I think, at least for me, like as I've trained, it used to be about going to the gym and being strong and, impressing whoever at the gym for no reason at all. But now it's like I just want to be able to live. I just want to be able to go hike and go on my hunt in October and not, you know, be out of shape and be able to do those things. And I think that's what most people want too. They just want, like, they go there for a reason, and they go there to be able to enjoy their life and to enjoy their family. And I think that's like the main thing. And that's really,
Absolutely.
really what I want for them too. Like as they end their time with me, like that's the biggest thing.
How long have you been doing it online?
So I've been online coaching for, I think, like 2 years, 2.5 years maybe. I
Okay.
was a trainer before, so in past life, I was a trainer, in person, and then I bartended for a while, and then I went back to PA school. So I used to train people in person, but yeah, I think the online thing, obviously, you have more reach and able to kind of help in, like, it's it's not, obviously you're not in person, but I think like having the touch points, like we can talk at any point, right? And we can talk about things at any time of the day, and you can bounce, your ideas off of me, and I think it's pretty cool in that way,
Hmm.
like you have access to somebody that you wouldn't normally have access to if I was just training you in person.
Yeah,
You'd see me once a week, twice a week for 30 minutes, for 45 minutes, whatever it may be, and so I think there's advantages and disadvantages to the online virtual stuff.
for sure.
Yeah.
What is the like end game? Like it seems like you are passionate and enjoy your PA job. Like, do you want to grow online to where you don't have to do that, or can you, or is that something you like to do, and then you also like to help more people online because it's broader reach?
Yeah, so I battle with myself because
Yeah.
when you when you get to a point of trying to expand the online thing, it gets to a point where you can't personally do it all yourself.
For
And then you
sure.
have to start delegating, and then you bring on other coaches to help you. But the problem I have is that, like, you know, my advertising or whatever it may be, people sign up to work with me. And I
Mhm.
think I think it's kind of doing them a disservice if I were to continue to expand and be like, "Oh, great, we're gonna get you all signed up, but then you're gonna work with this coach,
Yeah,
right? You're not really gonna work with me." So I kind of battle with myself there. Um, I think what I'm doing is great. I would I wouldn't mind cutting down like the PA side of things,
yeah,
maybe a couple days, just because of the difficulties there with patients. But
yeah.
um, but yeah, I mean, I'm happy with what I'm doing right now, and just kind of gotta see where it goes. You know?
Outside of movement and exercise, when if somebody were to ask me like, "Hey Chase, I want to live a long, healthy, high quality life," like I would put like movement and exercise, then like
Mhm.
right below that, sleep and like nutrition. Those two would be battling like underneath that. Is then after that, is there anything else that you kind of put a lot of stock into? Like I've got a sauna behind me, or like cold plunge, or anything like that. That you're like, hey, these things. If you're doing those other things right, these things will also help you move the needle.
Yeah. So I think, like you said, obviously diet and exercise up top, sleep. There's like the triad, like the three main
Hmm.
things. Sauna is fantastic. I think that's super underrated. I think the cold plunge was like the big thing, and probably, it still kind of is the big thing.
Hmm.
I'm not a big fan of the cold plunge. Um, I'd
Yeah.
much rather do the sauna, and I think there's more benefit to the sauna. But I think below that, I think I would have to put like social interactions. I
Yeah.
think I think that's like another super underrated thing that a lot of people don't think about as being important because maybe they have it and they don't realize how much it's contributing to their health. But I think like I referenced before, like I see patients on a monthly basis, so I see them every month, and a lot of my patients are older, and it's the only time they get out of the house every month, and they don't have a social system, and you can just kind of see it like it's taking a toll on them.
Hmm.
And I think having a good social circle, close friends or family that you do stuff with and enjoy life with, I think is right up there.
Yeah. That's something that even I forget all the time, and it's crazy. Like moving with my wife out of state to here, we didn't know anybody. We don't have any family out here. Obviously, so social circle went from
Yeah,
active to zero. Like we had to find friends, and um, I started doing like I just found a local CrossFit gym, started dropping in a couple times,
mhm,
and then I just started coaching. I was like, hey, I want to coach, four classes a week, 4 hours a week. I can do
yeah,
evenings or I can do Saturdays and Sundays, and and I hadn't coached in a while, so I was just like I wanted to meet people, I wanted to hang out, and
yeah,
what I realized like after I started like a couple months where I really got to know the community, really got to know the people, like I was a much better athlete, like husband, friend, like after those coaching experiences. Cause like I'm socializing, I'm getting this community aspect, I'm helping people, I'm seeing like immediate improvements where like, you can give them a good cue and you can make them move a little bit better. And it's crazy how much that just improves my mood and makes me want to just be better is when you have those community aspects.
yeah. I think it really elevates things, and and like I said, it's a sleeper that you don't think about it until you don't have it. Like when you move away and you're like, oh
Yep.
man, like what do we do here? Um, so I think that's crucial. Right under all those other things, if not just as important.
Absolutely.
Yeah.
Well, Chris, I really appreciate your time getting to talk to you. Where can people find more? Where can they get coaching or just follow along?
Yeah, so I think the easiest place is just my Instagram, and it's just my name, Chris Hover underscore after the Hover. Um, I do most of my stuff there. Um, my my link to my coaching website is there, and yeah, that's where I put all my stuff for my back pain and
Mhm.
all the things that I do to kind of to help. So
Yeah, it's super helpful, super good content you post. Like very actionable. It's like, hey, let me
hmm,
start implementing this. Let me do this. I love it. I love what you're posting and you're putting out.
I appreciate it, man.
Yeah. Well, I've got a tradition on this podcast where I ask my guests if they had a podcast or if they could talk to somebody, assuming that person is alive and well, who would
Uh-huh.
that person be for you? And then I'll do my best to try and get them on, and of course credit
Okay,
them with them being here because of you.
that's a great question, man. Somebody in it could be anybody. Is that not like
Anybody?
not in a health and
No,
wellness
yeah,
space?
yeah. Like I've had people say, like Tom Brady, obviously not big enough yet to get Tom Brady on, but at some
Oh
point,
yeah.
so whomever it would be that you'd be most interested in speaking to
Personally,
personally.
personally. Ooh, that's a tough question, man. That's a good one. Because like my mind first went to like comedians. Because like my
Yeah.
friend, I don't know, like a Shane Gillis or like a
Yeah.
um
That would be great. I would love to talk to them. I don't even know. Like, I love watching like the short clips of of like Shane Gillis and
so
Theo
I'm
Vaughn,
good
dude.
friends with his buddy Matt. He does a podcast with Matt McCusker,
Okay.
and I went to high school with Matt, and now they're both in Austin doing their
Yeah.
comedy
That's awesome, man.
stuff.
Sometimes like I'll put on YouTube clips of just like Theo Vaughn like making comedians laugh or whatever, like Shane Gillis or whatever, and I just start dying. It's so funny.
Yeah. You watch
I love.
you watch Tires?
I haven't seen Tires. I've seen clips of Tires. Do you recommend it?
Yeah, it's good. It's yeah, they're short
Yeah.
episodes. They're like 20-minute episodes.
Okay.
But now it's a good watch. Um, who would I enjoy talking to? Like, I think with my interest, I think somebody like Dr. Rhonda Patrick. I think she's been
Mm,
on Rogan and stuff.
mhm.
But she's like super research based and like I feel like she puts out a lot of knowledge.
Yeah.
Somebody to like pick a brain like that. Um, Man,
I
that puts
love
me on the
Dr.
spot.
Rhonda Patrick.
Yeah,
No, yeah,
she's a,
it is definitely an on the spot question. Like Dr. Rhonda Patrick would be somebody I would absolutely love to talk to. Like,
yeah. Oh, I mean, 'cause
obviously,
she
like,
gets into
yeah,
super
like,
detail about like very specific things.
yeah, she put me onto the sauna for sure back in the
Yeah,
early years and everything when like she was the big proponent of that.
yeah.
Yeah, I think that's a good one. I'll do my best to get her.
There you go.
I I did speak to Dr. Kay Linker. She's phenomenal, a neuroscientist and very similar vein in terms of like very research based and very like longevity based. And she was super fun to talk to, very cool person. So I would definitely love to talk to more people like that.
Yeah, that'd be awesome, man.
Yeah. Awesome, Chris. Well, again, I really appreciate your time. It was a pleasure getting to talk to you, dude. And I again appreciate everything you're putting out on social media. It's super useful.
Likewise, man. I appreciate you having me on.